as a parent, it is important to teach your children about oral health at a very young age. Dental care is not only linked to a person's overall health, but a new study is also linking it to their schooling. Joining me now with more tips on keeping your child's teeth healthy is Dr. Kami Haas from the Super Dentist. Good morning.
Good morning. How you doing?
Thank you for being with us.
Thanks.
Okay, so this is interesting because it's saying that your oral health can directly lead to how focused you are in school, how you're doing in school. What's the connection there?
Okay, so 51 million hours of school is missed every year because of dental problems.
Really?
Well, think about it. Yeah, from two reasons. One is dental pain. If you had a toothache, could you sit in class and listen to your teacher?
No.
I wouldn't, right? Also, if you didn't sleep well, so when you have sleep issues, like if you have a toothache, you can't sleep. But also if your mouth is small and you snore a lot, or if you have, if you are fed before you go to bed, sometimes that can wake you up during the nighttime. So if you can't sleep really well because of oral issues, or if you have a toothache, you can't sit in class. Also, ADHD symptoms, sometimes it's not because of the actual ADHD, it's because you have sleep deprivation, and so that causes you to be hyperactive and you can't listen in class. So a lot of studies have showed that good oral health gives you, better grades, and when you don't get good academic work during elementary school, then that's a really good indication that during the high school you're going to have some problems as well.
Yeah, and I guess it starts at a very early age.
Always.
So 1, 4, 7, those are the important numbers to remember,
That's
right?
right. So 1, 4, 7. So at age 1, you want to see a pediatric dentist. No later than age 1, by the way. So we recommend to see a pediatric dentist as early as when the baby is born, or at least when the baby teeth starts coming in at about 6 months of age. If you have other problems, like if you have moms have a problem with breastfeeding, for example, if they've really figured out that there's nothing else going on, patients, up to 10% of the kids have a tongue tie,
right,
and that causes problems with breastfeeding. So that's the time to see the pediatric dentist, because many pediatric dentists have tools to remove the tongue tie very easily. But no later than age 1 for sure. Age 4, no later than age 4 to get rid of all the bad habits. So if the kids have a pacifier, they suck their thumb, they should really get rid of those habits much, much earlier, because all of those habits actually completely change the way your mouth grows. But by age 7, absolutely the age limit, and then by age 7, you want to see an orthodontist. Again, that's the outer limit, because if your mouth, the bite doesn't fit together and the jaws are not correctly growing, we want to fix that growth when the kids are much younger, not when all the permanent teeth come in.
Okay, so you're asking here, can you prevent cavities and crooked teeth?
Yes and yes. So cavities, I think, is easier to understand because, we know if you don't eat a lot of sugar and you brush your teeth, generally speaking, you can avoid cavities, right? Of course, there's a lot of other factors like genetics and the bacterial formation in your mouth and all of those. But crooked teeth is something that people get surprised when I tell them for a lot of cases, you can prevent crooked teeth. So, because crooked teeth is not only caused by genetics, many of it is caused because the mouth has not grown correctly. And there's a lot of factors that causes the mouth to grow either healthy, correctly, or unhealthy. For example, it starts with breastfeeding again. Because when kids breastfeed, they have to use the muscles of their mouth to do the work versus just, pouring down the milk with a bottle with them. So it starts with that age. If the tongue has, rest against the palate, we swallow about 2,000 times a day. So every time we swallow, we push our tongue against the palate, and that grows the palate. For example, if the jaw is small, we'd rather expand it and put some very preventive measures when the kids are younger to get that growth going. Airway, if the kids breathe through their nose, that nasal airway breathing helps the palate grow normally. So if the kids breathe with their mouth, that also causes more crooked teeth.
And that's something you say to keep an eye out for. So if your child is snoring and breathing through their mouth, those are 2 things that you really need to pay attention to.
Yeah, those are the 2 easiest signs that parents should know that something's wrong. No kid should ever snore. In fact, no adult should ever snore, but for sure children should not snore at all.
What if they have, a young kid, they're always getting colds and things like that?
That's different. I think I should never say never, right? Because the 2 conditions that they can breathe through their mouth is they have a congestion, of course, if they're exercising really, really hard. Other than those 2 conditions, they should never breathe through their mouth. So if you see your child watching TV or they're sleeping for sure and they have their mouth open like this, there's a problem, because kids should breathe through their nose, and that helps the growth of the mouth in a healthy way.
Yeah. Okay, well, these are important tips to keep in mind, and it starts very early, so maybe if you're behind the curve, get on top of it, because new studies are saying it's more and more important. So there is a special event, Mommy and Me series, play date tonight from 6 to 7:30 at the Super Dentist location in Eastlake. So if you missed that information, which is there on your screen, we'll have it again on our website at KUSI.com. Dr. Haas, thank you so much for coming in. Appreciate it.